Hello, this is Dr. Seema Aden. Today I want to talk about inflammation, and I'm sure that you have uh, heard about the term inflammation, and so many of you already know plenty of information. But let's just review, okay? So inflammation actually, it's a good, healthy response that our body shows when we have foreign invaders, such as infectious diseases like virus, bacteria, parasites, or allergens, correct? In order to get rid of those. Or there is a trauma, like for instance, if we have a sprained ankle, so inflammation happens in an attempt to heal that area. So this is all good. Inflammation is really good. Not only it helps us to be protected, also it keeps our immune cells in check. And again, as you've heard of this, use it or lose it, because our immune cells, they constantly have to be getting trained, correct? So, but again, when that inflammation happens in those situations, that usually those type of inflammation are acute, the inflammatory response has to stop in a healthy, timely manner, correct? But what happens is that though, there are situations that they kind of produce the signal for inflammation, and that inflammation is not acute and can go on chronically for days, weeks, months, and sometimes years. And this is when we get into trouble, basically, because as we know, the chronic inflammation, it seems to be one of the very important underlying causes of chronic diseases, such as cardiovascular disease, diseases of the brain, such as stroke, the aging diseases of the brain, like dementia, Alzheimer's, Parkinson, MS, anxiety, depression. Also, diabetes and the consequences of diabetes, chronic inflammation is a factor of it, and also cancer, to name a few. So, what are the causes of chronic inflammation? So, let's talk about one at a time. The first one, let's talk about obesity, especially somebody who has abdominal fat. If you think about a person that somewhat has a flat abdomen, correct? The number of fat cells are very minimal. But as that person is gaining weight, the number of fat cells increase. And as a result, the size also becomes bigger. The combination of increase in the size and then the number of the fat cells causes those fat cells that produce chemicals that they send a message to our immune cells to come on in. And they invite the immune cells that we call macrophages. When those macrophages come to the fat cell area, to the, like say, abdominal area, they produce other chemicals that we call them cytokines that are extremely inflammatory. And when we talk about inflammation, we always talk about the end point, the tissue that is being red, swollen, painful, and not functioning properly, correct? So those chemicals or cytokines, they're going to be produced inside the fat cells. And when you look at somebody with the abdominal fat, their abdominal fats actually are oozing those cytokines into the bloodstream, and then those chemicals, they travel from head to toe, and they can cause inflammatory damage in all over the body. And there's some places that could be more sensitive for different people, that they can get the damage of the inflammation more than other areas, correct? So abdominal obesity is one of the reasons. The other one that is kind of connected is the diet, the way that we eat, especially the modern way of diet or standard American diet that has a lot of trigger foods in it, such as sugar, refined carbohydrate, fried food, artificial flavoring, artificial coloring in it, and so artificial sweeteners. I don't know if I mentioned or not. So these are all the food ingredients that they come into our body that are extremely, extremely inflammatory. And because we are eating them and we are exposed to them most days than not, so the inflammation is going to be there, and it's going to be a low-grade chronic inflammation that's going to be there day in, day out. And even though it's a low-grade inflammation, it has a cumulative effect over the course of months and years and decades. Okay? Another reason for inflammation, especially low-grade chronic inflammation, is stress. Let's talk about stress. When we usually, again, at least it was my perception of stress, that if I'm stressed, if I'm angry, if I'm fighting with somebody, if I am being late to my appointment, let's say, if I'm in the middle of a divorce, or if I'm grieving, those are the situations that I always qualify as a source of stress. But it's not always the same. A person could go every night, most nights per week, and having parties and drinking alcohol, smoking, and really having a good time. But again, because those are the things that are too much for our body, they're going to be perceived as stress. When something is too much or sometimes too little, it's going to be perceived as stress, and stress can trigger the inflammatory response. And actually, they are inflammatory brain cells that we call glial cells that are very sensitive to the hormones that are going to be produced and signals that are going to be produced as a result of stress. And they do produce chemicals that are very inflammatory. Again, they go into the blood and they transfer from head to toe and can cause damage over time. So, and like for instance, if somebody is undernourished, for instance, again, too little of something that our body wants also, like for anemia, bulimia or anorexia individuals, again, this is not normal for the body, and body goes into the stress mode, and also body goes into the fight or flight, and as a protective defense, inflammatory reaction is going to be started. So another reason for chronic low-grade inflammation is sleep. When we don't have good quality sleep, most days are not, again, our body is in fight or flight. It's as if something that shouldn't be in our body is invading in our body, and our body produces inflammation against it. Food allergies and food sensitivities, again, another sources of inflammation. Hormonal imbalances such as estrogen, progesterone, testosterone, if these are being imbalances, again, they are going to create a situation of this stressful situation in our body that then it can cause chronic and low-grade inflammation. And again, chronic low-grade inflammation over time, it has, as I said, it has a cumulative effect. So I just wanted to touch on few things that, as a refresher course, that every day we could be facing that can add to the pool of the inflammatory reactions in our body. And again, as I said, inflammation, chronic inflammation is one of the major underlying causes of the chronic diseases. And again, what we are doing is that to prevent those chronic diseases. Why not getting educated about the main causes of them? And again, now there are markers that we can test in the blood. And but again, now actually with the genetic testing, we can actually see each person's genetic capability to control inflammation. And which, the nutrigenomic panel that I do frequently in my practice, it's a very eye-opening basically test that patient can have one time for all and see how their body manages genetically manages the inflammation aside from the lifestyle factors, correct? And again, remember, know your genes and control your health.